Hi, Dr. Raj here, and another tip for my wonderful medical students, residents, and of course, my fellows. So, in order to do well on your exams, on the wards, to get the score you want, to impress the doctor you want for that residency and fellowship, well, you know what's very important beyond eating well and exercising? Yep, it's sleep. It definitely is sleep. So I want to say a couple things that I have noticed during this pandemic. So many of my patients, whether they have COVID-19 or not, have been coming up to me telling me, Dr. Raj, I've been dreaming so much. And when we talk about these dreams are very vivid. They are kind of strange, kind of odd, and they've been remembering their dreams, which is not that common. So when people ask me, am I surprised that people are dreaming more during a pandemic, during a crisis? The answer is no. And what's a classic example of that? What about 9/11? What about the World Trade Center? That's many people were having many, many vivid dreams during that time. But why now? Why during this pandemic? So the answer is, ever since we had the lockdown here in the States or across the world, that our circadian rhythms have been turned upside down. So in fact, in the United States, our total sleep time has increased by 20%. What does that mean? The more time to sleep, the more time to, that's right, dream. And many of us have been going to bed later and waking up much, much later. And you know what? When someone says, I'm having vivid dreams, well, these are usually the dreams that occur during a certain part of sleep called REM sleep, which we have a lot of in the morning itself. But I definitely want to mention a few things, which is going to be for my frontline healthcare workers in the emergency department, in the ICU, and to the patients who were stuck in the hospital because they're ill, some on ventilators for long periods of time. You know, they've been having really scary dreams and nightmares. You know why? Post-traumatic stress disorder. So if you are getting recurrent nightmares, don't keep it to yourself, tell your doctor so they could actually maybe help you out or point you in the right direction. And before we say goodbye, a very common question that people have asked me, my students, about getting good sleep. Well, what about melatonin in the setting of COVID-19? So melatonin, as you know, is a dietary supplement that you can get over the counter. And it mimics a hormone that's natural in your body. But the question now has become, does melatonin help for inflammation? Does it help out in your immune system? Does it do anything to COVID-19? So this question was answered by let me take that back. It really wasn't answered. It was looked into by a very small study in New York. And it was a retrospective study. People were very sick on the ventilators, and these people got melatonin, and it had some positive results. But please don't start running out buying all the melatonin out there, because it's just one study and it was retrospective. But if you were to take melatonin for a few days while you're feeling ill, is that going to harm you? Probably not. But you know what I always do first? Tell your doctor. And but if you are insistent about taking it, the question is, well, what dose? And for sleep, my patients usually take somewhere between 1 to 3 milligrams 2 hours before their desired bedtime. So that's kind of the dosing. And I hope that these tips, this information, helps you succeed in your course, getting the scores you want, the residency you want, and passing those board exams.